Hi everybody, it's Dr. Robert Pearce. I'm an Australian family doctor and I have an interest in overweight. I don't call it obesity because that's a rather pejorative label. People don't like to be called things like that. It's rather insulting. So overweight's fine. I'm happy with that, even if it's extreme. So what causes this? What can we do about it? Why don't diets work? How can we get results? Well, I think the main problem here that's not looked at by obesity researchers is psychiatric. Many, maybe most overweight people, not all of them, but probably most of them, are anxious people who feel better when they eat too much. It's called comfort eating. And I've got a bit of a handle on this, and I've got something that might treat this. So we have also perhaps calm people with no anxiety. Food tastes good, they get overweight. If it's a fatty diet, they're going to get diabetes and heart disease. But if it's just potatoes and pasta, they'll put on some harmless fat, and we're not worried about those people. They just need to educate themselves and go to a gym. We've got a special problem with the anxious folks, which is probably the majority of overweight and obese people, including children, in this world. It's a new epidemic coming on. I think what we've got to work out is where this comes from. Where does this anxiety come from that causes people to crave food? They may also crave marijuana and cigarettes and other nice things, but they frequently go for food like chocolate. So I've got something to say about this because I've done some research on this. I've been able to show from research done in 1997, collecting evidence that anxious people come from pregnancies where the mother has accidentally, inadvertently, unintentionally consumed too much saturated fat, usually dairy fat or chocolate. So it's butter, cream, ice cream, cheese, chocolate, not usually meat fat. Cakes and pastries figure in this because they often have bakery fat. So it's saturated fat, which inflames the placenta slightly, often causes gestational diabetes in the mother, and this is about a quarter of all pregnancies. Could be worse in England. And we get cortisol hormone, a stress hormone from the mother's blood, in these conditions leaking across a slightly inflamed placenta and programming permanent anxiety in the baby's brain. So what can we do about this? It's about 1 in 4 of all Westerners. It could be 1 in 3 in England or in Scotland. It's about 30% in New Zealand. I don't know how many people are anxious in America. I think it's more than 20%. I think it's 30% or more. So we've got a lot of folks out there who are anxious. How do we diagnose this anxiety? Well, we ask, were you shy in childhood or very sensitive? And are you a lifelong worrier? Do you worry excessively about little things? Put those two together, we've got anxiety disorder. It takes 10 seconds to ask about in a family practice. So what's the next step? What can we do about this? The psychotherapy, psychologists are good, but can you get a permanent result? Maybe not. They're good for what they're worth, and I frequently refer to psychologists. But I've got something more fundamental, and that is I've got a low-fat diet to clear depression, because they're often depressed, these people, but it doesn't get rid of the anxiety. Fortunately, there is something specific which we can give for anxiety, and it's a seed sugar called Inositol, found in grains and legumes and rock melon and citrus. Now, this can be extracted from rice bran in China and Japan. It is available in Australia. There may be some in Europe or England, not so much perhaps, and it might be dearer there. It is available in America. Now, the most important thing about this seed sugar is that in its isolated, concentrated form, it was first used in Israel in the mid-1990s in Beersheba to treat depression and panic attacks and eating disorders, and I deduce from this that it should be effective in anxiety. So I've tested it now in the last 10 years in about over 2,000 of my own patients, and it is remarkably effective in anxiety disorder. Within 3 or 4 days, their patients consistently report most unusual energy, that they're not used to racing up the stairs and faster on the treadmill at the gym. They're very, very pleased with the new energy, and they simultaneously lose interest in chocolate cake, or smoking, or marijuana, or too much beer. But I frequently see chocoholics, and those people will tell you, I just don't want the chocolate. It's too sweet now. I used to love it. I love doing salads and tomato now. I just got a different brain. I just think differently. I eat differently. And after about a week, they're calm and clear and confident. They wake up in the morning. These people used to be anxious. They're no longer anxious. Their brain fog in the morning is gone. There's no fog in their brain. They're alert and fresh when they wake up. Don't get tired in the afternoon. That's in about a week. Over the next few weeks, they notice that they're losing fat off the middle if they need to lose fat. They gain muscle. Their muscle increases in size around their arms and legs. They're pleased with that. They're much more energetic. And in women, the hair and nails grow faster, which may be better growth hormone secretion from the brain, affecting the growth of these protein tissues, the hair and nails, which also look good. They look shiny and they're strong. And the libido is often a lot better. which you won't see with antidepressant drugs. You'll see the exact opposite, and they have better immunity against coughs and colds. So here we have a new treatment for anxiety disorder, which will also cause a loss of interest in fattening sweet foods. The result is that my patients report about 4 to 10 kilograms weight loss within 6 to 8 weeks. That's pretty good. That's twice as good as anti-obesity drugs cause, which is 2 to 5 kilograms. I'm seeing 4 to 10 kilograms, and also quite frequently well over 10 kilograms. And one man who was 196 kilograms, using only 5 grams of inositol a day, has lost in 18 months 99 kilograms. He's actually lighter than me, and he's now got a job for the first time in his life as a hospital porter, and he's quite strong. He can lift the patients and handle the patients easily. He looks good. He's hovering around 97 kilograms. He's aiming at 83 for some reason. That's his personal target. He'll get there eventually. And this is costing him 50 cents a day. So here we have a new treatment for overweight where it's related to comfort eating or overeating in anxious people who are extremely common in Western societies. And so this may be the answer. A particular aspect of this is that although people over the age of about 14 probably need to buy the supplement to get 4 or 5 grams of inositol a day, this is not necessarily the case in young children. You've got an anxious, plump, scared young 7-year-old eating everything and overweight. You'll get there with diet. I've got a few children doing this. They've got whole grains, legumes, lots of orange juice, and they lose weight, their muscles are better, and they start winning races at school, and they concentrate better, they study better. That's not done with a supplement. That can be done with a low-fat, high inositol diet rich in the usual things: corn, oats, nuts, beans, rock melon and citrus. So that's good news for the kids up to maybe 10 or 12 years. When they get to the teenage years, they probably need more like an adult dose, perhaps a level teaspoon of inositol. It's 2.5 grams, plus about 1.5 grams from the diet, which is 4 grams. I treat adults with 5 grams. So we've got a new treatment here, I'm proud to say, and this could make all the difference around the world in curtailing the obesity epidemic. And I would add, finally, that the inositol also boosts insulin action. It's anti-diabetic in the same people. And so inositol has been used in quite a few trials in overweight women with polycystic ovary syndrome, and they very good results in dropping the glucose in their blood and the insulin and the triglycerides, getting weight off, and blood pressure falling. So it's been shown to have these superb metabolic effects, and finally it also activates anti-aging genes, which themselves promote a degree of leanness and toughness and extra energy in muscles. And just the extra energy from the anti-aging effects and from no longer being anxious, 2 new forms of energy, means that these people can go to the gym where they couldn't go there before. They can race up the stairs, they're 25% faster on the treadmill, they can lift their weights about 18% better in the gym, horizontal bench press, and they've got the muscles which will go right through their life. They've got the muscles to lead a very energetic life, where otherwise they're going to be bogged down and sedentary, getting heart attacks and never moving. So we've got a tremendous breakthrough here, and it all depends on a simple sugar found in seeds and grains and nuts and beans and rock melon and citrus, and that's the end of my story.